Okay, so again, welcome everyone to this morning's session, which is a Stronger Voice Expert Seminar on influencing local authorities on accommodation. My name is Bryn Hall and I'm the Senior Development Officer here at Clinks, and I'm today's chair. I'm also joined by my colleague Olivia, who's going to be looking out for all of the questions in the background. Unfortunately, this morning, one of our speakers hasn't been able to make it. Sarah Burke from the Probation Service in Wales isn't able to be with us this morning, so apologies for that. But what we will do is we will make sure that we capture what Sarah was going to talk to us about in a case study, and we'll look to include that within the meeting notes and put that onto our website so that we can share any information that Sarah is going to talk to us about this morning. But we still have Sarah Paul, who is the Homelessness Prevention Lead for Greater Manchester Probation Service, and her colleague Jo Donohue, who is the Homelessness Strategy Principal, Public Service Reform for Greater Manchester Combined Authority, and we're really looking forward to hearing from Sarah and Joseph this morning. So just briefly, as I said, it's going to be a slightly shorter session this morning, so we'll look to keep to about an hour this morning. So again, apologies for that, but these things can't be helped. As said, please do feel free to ask any questions. If you think of a question during Sarah and Joseph's presentation, please pop them into the chat box function, and we will have time for a question and answer session at the end, and really welcome anyone raising their virtual or physical hands to ask questions at the end. If you can save your questions till after Sarah and Joe's presentation, that'd be great. So this event is part of the Stronger Voice project, which is a 3-year project funded by the Lloyds Bank Foundation for England and Wales, and the project aims to help the voluntary sector working in criminal justice to develop a unified and influential voice at both a national and regional level. Through this programme, Clinks are bringing together experts across policy, campaigns and communications for a range of free events, training and coaching opportunities to support organisations of all sizes to feel more confident in influencing policy and campaigning for change. The project is coming to an end in March, but there's still some events coming up on our website. Is that correct, Olivia? This isn't the last one. No, we've still got some more coming up.
Yeah, we've got one next week on influencing officials, doing inside track in influencing, where we're going to speak to some senior civil servants in the Ministry of Justice. And we've got a comms coffee morning in March, where you can talk about, come and join and learn about how to develop key messages for your organisation. So take a look on our website. I'll post a link in the chat now.
Fab, thanks Olivia, that's great. So yeah, I just wanted to mention also, because obviously this expert seminar today is around accommodation, that back in January, Clinks held a roundtable with officials from the MOJ and the Department of Levelling Up Housing and Communities. I think I've got that the right way around, on accommodation of prison leavers, and we did have some of our members attend that roundtable as well. Notes from that meeting will be available on the Clinks website in due course, but I think one of the key themes that came out of that was a lack of communication and awareness of the different accommodation programs, and a real sense of a need for better information sharing. So just mentioning that within the context of today. So today's session is about working with local authorities to influence the way that services are run for people leaving the criminal justice system. And obviously we're looking specifically at accommodation. So obviously Sarah Burke from Wales isn't with us today, but both Wales and Greater Manchester have done things differently with their community accommodation service tier 3 or CAS 3 contracts in order to deliver wraparound support for people leaving the criminal justice system. By working with local authorities, they've built models of good practice based on whole systems approach. So we hope that you'll leave this session with an understanding of the different approaches and strategies delivery organisations can take with local authorities to advocate for people in contact with the criminal justice system. And as I mentioned, we will look to get a case study off of Sarah so that we can highlight what is going on in Wales as well. So our presentation today is from Sarah Paul. Sarah is the Homelessness Prevention Lead for Greater Manchester Probation Service. Sarah played an instrumental role in the emergency COVID-19 trailblazer for safe accommodation of people leaving prison in a public health crisis. This formed the foundations of the regional whole systems approach to the community accommodation service for people leaving prison who are experiencing homelessness. Previously, Sarah has implemented the offender personality disorder strategy alongside health colleagues within local custodial and community settings. She has coordinated regional multi-agency public protection arrangements whilst co-located with Greater Manchester Police Sex Offender Management Unit. Sarah is joined by a colleague, Joe Donohue, who is the Homelessness Strategy Principal, Public Service Reform for Greater Manchester Combined Authority. So I'm going to pass over to Sarah and Joe to take us through this morning's presentation.
Thanks, Bryn, and good morning, everyone. I'm going to do the perilous screen share, so I'd appreciate a thumbs up to let us know that we've got the slides up. Excellent, thank you very much. So good morning, everyone. As Bryn said, so my name's Joe. So I work at Greater Manchester Combined Authority in a homelessness role. And I'm joined by my colleague Sarah at Greater Manchester Probation Services. And I guess the theme of today is about collaboration and sitting alongside and commissioning alongside probation and local authority colleagues. Because at the end of the day, we all want the same outcome, a seamless service that works for people and genuinely transforms people's lives. So we're going to talk a bit about CAS 3, but I thought I would open with a bit of scene setting, which might help to describe some of the work we do in Greater Manchester in a little bit greater detail. So I guess the key to our approach is just recognising that CAS 3 doesn't stand in isolation. It's one part of a continuum of interventions that seek to prevent and relieve homelessness. And we describe this predominantly through the lens of our Greater Manchester Homelessness Prevention Strategy, which was developed over the period of about 18 months with various people from different parts of the system, from sector actors, the voluntary sector, and people with lived experience of homelessness through a really creative co-production process. And what we were really key that we didn't want to do in developing a homelessness prevention strategy was fall into that trap of doing the typical kind of specific action-led local authority strategy that focuses exclusively on the part which local authorities play, but instead create something that's more inclusive and reflects the fact that everybody has an interest in preventing homelessness, and we all have a role to play within that. So instead, we sought to set out a series of missions that everybody could agree are what we want to see from homelessness prevention across a number of different levels. And spent quite a lot of time diving into what those missions should look like and reflecting the varied experiences of people across the system and where things go right and where things go wrong. So taking those in turn, looking at the sort of highest level of homelessness prevention, that universal view, the idea that everybody should be able to access and sustain a safe, decent, accessible and affordable home. And that where people are in a position of care, when they're in a place of care, that could be the criminal justice system, but it could be hospital or health services, that where those transitions happen, that people leave those places of care with somewhere safe to go. We know that even the most preventative systems will end up with people experiencing homelessness in the first place through crises. And when they happen, we should collectively across the system be able to offer quality advice, advocacy and support to prevent that from resulting in some of the more acute forms of homelessness. We know that there will be occasional irreconcilable situations where people do experience homelessness, whether that's temporary accommodation, street homelessness, etc. But that the accommodation and support services offered to people provides safe respite and promote recovery and reconnection to their community. And finally, that where people are experiencing homelessness, and particularly street homelessness, that's never an entrenched or repeat experience. And so seeing prevention across those 5 missions gives you a really broad but quite useful way in which to look across the various different lanes that are often created by commissioning approaches and get away from that input outcome approach to start to see a whole system rather than a discrete service. So I suppose in terms of what that actually means, I guess from a commissioning perspective, and both Sarah and myself are commissioners of services within our role, I guess what does a prevention strategy mean in that sense? And when you're looking at the whole system, it can be incredibly daunting to sort of go beyond your bit of the world and your expertise and your teams. What does that mean for us? And I guess what we're seeking to describe today is an approach that's more based on commissioning to learn rather than commissioning specifically for outcomes. So setting ourselves up to try new things, take risks, and do things differently, accept that not all of that will work, but that the output is as much about learning from what does work and what doesn't than it is about individual outcomes for people. And in setting yourself up in that mindset, generally speaking, the outcomes come. And I suppose that to sum all of that up and to couch it in a sort of whole system view of prevention, I guess it's about looking beyond single data points, understanding the bigger picture, and understanding the storytelling that sits behind the services we commission and the people that access them. And finally, to sort of create that culture of inquiry and to really interrogate and get to the root of issues that are causing homelessness, whether you're looking through a prison leavers lens or through a leaving care lens or whatever, to really understand what's happening, utilising the best data you've got available, allied with the voice of lived experience, and then critically actually doing something with it, being able to be adaptive and flexible and shift services and approaches as we go along. So that's the broader big picture thing, which I thought was really important to get out there first and foremost. But I will defer to Sarah for the an overview of how CAS3 works and how it is effective in Greater Manchester. I'll hand over to you, Sarah.
So we had the opportunity through the Ministry of Justice to create the Community Accommodation Service Tier 3. We were identified as early adopting areas. There were 5 early adopters and Manchester was one. And I think given the context that Joe has just set, it was really easy actually to look at the plan in terms of CAS3 and understand that bringing in private providers in this space would not work. So we kind of recognised that from the beginning and went to the Ministry of Justice with that context that Joe's just described and made a proposal. With that proposal came a completely different structure. So we were grant funded by the Ministry of Justice after a period of negotiation, because we are going outside of the structure of the service as it was developed. But our argument was that we could utilise trusted providers in this space and that we could prioritise a single system of resettlement for people leaving prison. So I think one of the principles throughout this is that we didn't want to develop a separate pathway for people leaving prison. The message is always an integrated public service offer. And really to highlight recognise that we can't do this alone. That picture that Joe's just described, it's an enormous task in terms of preventing homelessness, and to do that alone as the Probation Service or Ministry of Justice is kind of unrealistic. So we were looking to really strengthen relationships in the space and go on this journey. And essentially it's a journey where we are learning, we're focusing on opportunities for improvements, better understanding unmet need, and really sharing insights. So yeah, I think that was the context. And what we wanted to be able to do is collate a whole host of data in this space and collectively identify barriers and try and work towards addressing those. You can go to the next slide, Joe. So one of the principles, one of the kind of structures that we use in our approaches is something that I gained from Philip Stokoe. So it's Healthy and Unhealthy Organisations, a document that if any of you haven't read it, I would highly recommend reading. The 4 stages there, quite simple, but we work towards that collectively with the combined authority, so alongside Joe and colleagues. That our message throughout is that we need to have a shared clarity of primary task, develop shared principles, but in order to function collectively, everybody needs to be clear about where decision-making kind of delegation can happen and where the authority sits. And then this prioritizing the kind of management of good practice, or the way we kind of contain what we're doing, I guess, and make sure that that is a priority. So those 4 things are key to this kind of healthy organisation approach. And underneath that, we've used some of the, a quote actually that came from Wigan Council about the approach to the community accommodation service tier 3. So I think overall, and Joe mentioned it, it's really leaning on our primary task being a shared primary task, that our aims are the same. And within that space, we lean on each other's expertise. So like Joe said, it can be, I found it a terrifying process to go out there and actually say, I need to try and develop an accommodation service here, but I've got absolutely no experience in accommodation. What I can bring is my experience around risk, around the criminal justice service, because I am a probation officer by trade. So starting from that perspective, I think has been quite valued as well, because it brings kind of leaning on people's experience and knowledge, and recognizing what each of us can bring is really important in that space. So really prioritizing kind of inclusive partnership working, and working towards shared principles is really important. So I think, again, I started off trying to look for some consistency, maybe in quite a naive way, trying to look for some consistency in approach, where actually what you need to do when we're working as a region across all 10 local authorities is recognise the differences and recognise the need for different approaches in that space. So defining principles in lots of different ways is our way, is the best route to achieving what we need. So rather than really holding people to account from a contract perspective, we're looking much more at how we're achieving those principles in a flexible way. But within that, the kind of roles and responsibilities and clarity around that is really important. And I would say that that takes a lot of effort. And I don't think we're properly there yet. And I'll refer to that a bit more as we go down. But I think it's something that you need to keep refreshing, revisiting, recognising as the service develops. And it's really important to do that. And it's also really important to come together collectively and highlight what you all experience as good practice. So having spaces where we can discuss all of these things, maybe not necessarily directly, but the conversations about some of the operational work and the decisions that we make has been a real opportunity to evidence some of these things, I guess, how to collaborate effectively. We're happy to go on to the next slide, Joe. Thank you. So just to give a bit of detail, a bit of an overview, I've mentioned we've got 10 local housing authorities. As we roll out CAS 3 now across nationally, our colleagues in London are kind of sniggering at 10 local authorities because they've got, I think, 32. So, but for us, 10 local authorities does mean a variance of 10 different approaches. And that has been a challenge. So we're a small regional team based in probation that deal with all the referrals and identifying eligibility for the service. that then communicate with each local authority that has identified their own accommodation and support providers. So I've kind of put that to one side there because that is a tricky thing to do. It is the right thing to do, but it does make it more complicated for a small regional team. We've developed a specification, but we approach that specification with an element of flexibility, similar to the principles, because we need to understand the kind of difference in approach and what it means for each local authority has different capacity as well, because there's a huge variance in numbers required in each local authority. So the structures behind the service are very variable as well. We have a support provision that is provided either by local housing authorities or by some voluntary sector organisations and also by some lived experience organisations. So we've got a great collection of different perspectives that comes together in regional commissioning meetings and also through support provider meetings, which are really welcomed. Because bringing all of that information together and perspectives together gives us a kind of a wealth of really useful information. And we've also commissioned oversight by a third sector organisation called Just Life with a lot of experience in the temporary accommodation space. So I think one of the things that Bryn mentioned before was about the round table, identifying this understanding of the pathways. There's been enormous developments in this space, which is really, really welcomed. But I think there've been some unintended consequences of some of those developments. And we need to recognise some of those in an honest way together, perhaps bring in an external pair of eyes as well through through Just Life to support us in recognising those and maybe support us in developing the next steps to kind of the better information sharing that Bryn mentioned, the real kind of clarity as things moved around roles and responsibilities, because that's shifting as things change as well. So we have this commissioning partnership, which is Greater Manchester Combined Authority and the Probation Service. Then there's the delivery partnership that sits underneath that with those range of people that I've described. And the one section there that I haven't mentioned is the prisons. We obviously have a lot of contact with prisons, and there's also strategic housing specialists based in prisons now, a new role that has come alongside some of the CAS 3 developments, which supports in some of the challenges that I'm guessing you will all have experienced in terms of permeability of prison walls in this space, which is something that's been ongoing for a long time, but I think we're starting to bring some of that, bring some positives there, but there are still challenges there as well. So governance spaces, there's a bit of a picture coming up, which is terrifying in a way. So Jo, can we go on to the next slide and I'll talk here. I don't expect everyone to read or understand this, but what I wanted to show was kind of the governance spaces here and the framework. So we sit underneath HMPPS, Reducing Reoffending and Accommodation Directorate. We're funded by the Ministry of Justice, and they work alongside the Department of Levelling Up Housing and Communities to provide this service. So cross-governmental stuff going on, which is really great, but is quite new. And so a lot of it has been, as we've mentioned before, a really kind of interesting journey of learning. But there's a lot of people to keep happy within that space as well. And we always, there's a whole structure of meetings that are developed, some by Justice Devolution has provided us some really good spaces where we collaborate. There's also a lot of internal structures that have been developed to support the service itself, but really valuing the space that we can have together and focus on being curious, asking questions in an open and honest way as well, in a non-combative way. So I think sometimes as statutory agencies between prison and probation, certainly, between local authorities and probation, certainly, there's been a bit of a stigma developed And I think we're both independently probably dealing with a lot of negativity, and that needs to be recognised, that we're in quite similar spaces, and that some of the experiences we have are very similar. So rather than seeing some of the decisions that are made underneath legislation as an individual's decision making, it's really important to recognise that some of that sits within a legislative structure, so not locating decisions in individuals. And I think that's something that a kind of broader message that I think we're trying to communicate back into probation as well. We have some new spaces like the Criminal Justice Homelessness Prevention meeting, which is a collaborative meeting which brings everyone through the accommodation pathway in Greater Manchester together on a monthly basis to update on their kind of developments within their own organisations, and also to ask questions. Asking questions is kind of massively promoted. So we've had some conversations that would be seen as very operational, but have some big impacts for how the relationships develop between each organisation. I remember one example where a local authority colleague said to me, "You've shared this information about this person and their risk is medium on the information that you've shared. And when I look on our systems, we've got him as high risk." So that means there was kind of a question raised, and it was in a non-combative way, but it was like, "Are you misleading me here?" was the message. And actually, I was able to look at the information that we have and say, do you know what? In the last few years, he's come off substance misuse, he's stabilised in a way that we haven't seen before, which then impacts on his risk assessment in this way. And that's where we are now. And it led to a conversation about kind of dynamic risk assessments and things like that. But actually that feeds into a recognition of, you know, there's a variance there. Let's not interpret it as misleading. There are scenarios where things change, and that's important information. So if we can go on to the next slide, Joe, when you're ready. And this one is yours.
Yeah, I don't mind picking this one up. So I guess, having considering all of those various different layers and governance structures that underpin a lot of this work, I think the next step for us is to get to a sort of level of comfort that we've got that sort of deep partnership working relationships outside of the system. So loads of wonderful infrastructure across local authorities, probation service, and other bits of the system. The next step is very much reaching out, I think, and one of the key vehicles of that is the Greater Manchester Homelessness Action Network, which helped to create and continues to own the Greater Manchester Homelessness Prevention Strategy, and has been the key catalyst for all of our work to prevent homelessness and end rough sleeping within the region. So they really have an ownership role of those missions that we spoke about earlier. I mention this because I think there's the next stage of our criminal justice local authority cross-working journey is to get to position CAS3 and projects like it within this space and get access to what is a really powerful coalition of people with lived experience of disadvantage, professionals working across the sector, and really harnessing the insight and experience of our voluntary sector partners even further and beyond the commissioning arrangements that we've got with them, to get a whole cross-sector view of homelessness as it stands, to try and really unpick what people's experiences are, what are we seeing within the system, and to use that again, as we said earlier, to learn and to shift our policy priorities. So we're getting there, I'd say, in terms of involvement of probation colleagues within the network, and I think we're very much on a journey to getting towards that sort of outward-facing position for CAS3 and across probation services more broadly. And that allows us to bring that voice into the room, but really collaborate across sector. So when we're developing, strategy, policy, or lobbying priorities, that there are probation colleagues in the room armed with all of that insight and information from the approach to programs like CAS3 that can really enrich that conversation. So it's about getting beyond, again, as we keep saying, those traditional commissioning relationships and seeking to sit alongside partners from across the sector and work collectively together to drive change. And having that infrastructure in place is really, really helpful, because it allows us to set our professional insight alongside people with lived experience who are very active participants of these networks, and to help to create that unified voice around what's changing within our programs. How can we shift the way in which we commission services with the flexibility that's afforded to us? How can we, where possible, campaign together and develop a set of collective priorities around the change we want to see locally and nationally? And how do we adapt to changes in the operating environment? And it's a lot, when you sit alongside voluntary partners and people with lived experience, you get that feedback a hell of a lot more quickly than just going through traditional commissioner-provider relationships. Now, we mentioned this sort of broader voluntary sector partnership work, and I think it's probably worth saying we did a series of consultation pieces in the autumn with Greater Manchester Homelessness Action Network to figure out, just checking in on our prevention priorities. Are they still right? Are we still working towards the right things? And it was the first time that we'd seen CAS3 mentioned within that early consultation stuff. And that was really powerful for me, because unless you're working specifically in the criminal justice sector, whether it's for a statutory service or for a voluntary sector partner, you don't often know that these kinds of services exist, or what they do, or how that contributes towards the broader system. So I think the fact that we're talking about it beyond our bubble, and that people are recognizing that it is working well and that it's contributing, I think that's an incredibly powerful thing. And I suppose, although there's obviously a lot of capacity ask to get into these spaces and to give up our time to really learn from people that are doing the work day to day, or utilizing services on an ongoing basis, that it's worth it. And it's worth it for two reasons, I guess. First of all, it enables us to develop trust, a currency that's not always traded as much as it could be between statutory and voluntary services. So it's creating those trust-based relationships and allows that two-way dialogue with community organisations to better understand the work that probation services and local authorities are doing, understand the levers that we have available to us, and perhaps some of the pressures as well. So it creates that trust-based relationship with the broader sector. And then the other thing, I suppose, is where voluntary sector partnerships and networks spring up, they have really clear and often helpful lobbying asks and key priorities that they want to work towards to change the homelessness system, or more broadly, locally, or even nationally. And that can be really effective. But once you've got professionals in the room alongside those voluntary sector and lived experience voices, you get the whole picture, and you go from a position of one organisation lobbying on one specific issue towards something that looks more like a collective voice within a place. And that's so powerful because we know we don't always control all of the levers to affect the change we want to see. So where we don't, it's really, really powerful to have that collective voice about what a good transition might look like when leaving prison. So I'm going to hand back to Sarah, who's going to talk us through a little bit more of those kind of shared principles and wrap us up. And I'm really excited to hear your questions at the end.
So one of the things that just struck me was the kind of, as Joe was mentioning there, around trust. I think the building of trust has been absolutely key to achieving what we have. I would say as well that we, and just to reinforce the kind of the journey that we're on, we are not suggesting that we've sorted this. We are collectively working on resolving things as best we can in a really difficult climate, and recognizing some of the kind of broader challenges around sentencing, around short sentences, various different kind of the implications for people, and trying to bring together a lot of information that allows us to understand things a bit better. So before this service was developed, we had very simple information about people's accommodation on probation systems. There was nothing that we could sort of meaningfully reflect on or use. We're working towards cleansing data collectively, and that's local authorities and probation service to understand the people that are repeatedly coming through these the system. Why is that happening? What's their experience of things? So I've reinforced this requirement for shared responsibility, really trying to integrate working relationships from the lowest spatial level. This one workforce approach is something that as the service has developed, we've seen my team, the Homelessness Prevention team in probation, working alongside each of the local authorities, and we're almost creating a dynamic where we're a team in between the two organisations, and recognising kind of expertise within that. There's some areas where it's going better than others, but we're on that journey again. So we're just really trying to use this as an opportunity to learn collectively, but also to lean on the whole systems approach. So recognise where we are in the whole systems approach, which makes the service more resilient, has improved outcomes for the people coming through the service. We met a bit of a milestone this week that we've had 1,000 people placed in CAS 3 since its inception. So it's temporary accommodation, identify and move on, but 1,000 people leaving prison that have come through and been placed in CAS 3 is a huge number. And that is something that I've really kind of recognised amongst a whole range of partners, really, that it's a shared achievement, that, and I think that's some of the key to some of the success is really recognising that that's a shared achievement. Next slide, please, Joe. So we've talked a bit about this journey of learning, and I can't emphasise enough how important that is. So the diagram there is about feeding that information back into the organisations we work in, testing things out, understanding that there is a lot at stake in testing things out. So we have to be cognizant of the reality of the situation that we're operating in as well. Understanding that this is a demand failure resource, so we are hoping to undo the need for CAS 3 once we've developed the learning, rather than making this a permanent thing. It's actually working towards understanding why people have come to CAS 3. Really prioritising prevention, as Joe mentioned, which is something that as an organisation, I think the probation service can do much better at. So we are hearing from local authorities about kind of how we can best use opportunities to mediate with family and friends so that people can actually return to where safe to do so, can return to their family and friends, or understanding our approved premises division and the need for homelessness prevention within that space, and consideration of move on from what is a public protection placement but is also accommodation, and how that's perceived externally is really interesting at the moment. We're working towards kind of really strength-based approaches broadly, but using Manchester Metropolitan University's knowledge to help us improve that, because I think that is sometimes difficult in a risk space to understand how strength-based practice works. Feeding back information about recall decision making and the impact that that has. So I think as an organisation we focus on risk there, but if you look at some of the broader pictures, we've seen local authorities describe that people are in really positive positions in terms of their accommodation, and then what they perceive as small things lead to them being returned back to custody. So understanding about how information sharing could improve understanding of the decisions that are made, or how broadening consideration of every aspect of the individual's life might change some of those decisions. We mentioned information sharing before, Bryn mentioned it, and I think the timely sharing of relevant information is something that we are really kind of promoting, and it's a really difficult thing to do when people have enormous caseloads currently within probation. So planning for release and things like that need to be prioritised, but you have to do that bit by bit. Making sure that assessments are achieved by local authorities in terms of duty to refers prior to release is really important. I mentioned Just Life One Team approach. So that was the service that we've commissioned to have kind of an overview of the broad changes in the accommodation pathway from prison. And they are bringing all kind of stakeholders, including people who've lived experience of CAS 3, around the table in a one-team approach to try and understand the experience of CAS 3 for everybody involved, but also to promote that understanding of roles and responsibilities and who does what to avoid duplication, which will hopefully kind of impact some of this timely and relevant information sharing, because I think sometimes we're in a position at the moment where people are doing the same things alongside each other, but the communication isn't there, so that can be improved. We're developing a shared training schedule, which is a reciprocal kind of training schedule. So instead of paying for training, we've got a lot of people in different kind of areas of knowledge, and they can share some of their experience of things in this space. There's the Accommodation for Ex-Offenders funding, which is DLUC funding that was set up alongside CAS 3. That is funding that's provided to local authorities, but we're working really closely because of the way we've developed CAS 3. We work really closely with them on kind of reprofiling AFIO and how that can work best in the whole system. The peer support from GATE is working really, really well in one particular in Manchester, with On the Out providing lived experience support from the GATE to next steps. And we can see the merits of kind of, we've got an opportunity to almost compare the different approaches in this space, because there's the 10 different approaches, and you can see the value in each of the approaches, especially for the individual experiencing the service, and just really promoting that professional curiosity and just asking questions and being okay to kind of respond to questions that are asked and avoiding kind of defensiveness in that. So recognizing that instead of making assumptions can be damaging, so actually asking the questions is really, really important, and responding in a way that recognizes that not everybody knows the entirety of your remit and your role and your responsibility, or the reasons that decisions are made. But also I think we can come into the space where we say, we're not always right. So if you're pointing to something that we're doing wrong, let's have a look at how we do, like how we find a different way of working things. I think that just really kind of leaning towards that has been part of the success of the progress that we've made on this journey, I guess. Joe, do you have anything that you want to add before we open out to questions?
No, I don't think so. It's just, those key themes, isn't it? Collaboration and kind of professional curiosity, some of it well, but I guess probably looking back to the key principles that we developed in creating the homelessness prevention strategy, and the work that's followed out of that were very much reflected in the development of CAS 3, and that's that we should always strive to be person-centered in everything we do. We should always aim for prevention by design and work preventatively rather than managing demand. and that we should be participatory and create meaningful opportunities for people to get involved in the commissioning, design and delivery of services. And I think the approach that's been taken with CAS3 has ticked all three of those boxes. But as you say, Sarah, it's very much a journey, and when you set out to learn and have that sort of honest, open approach, it does take a bit of time. But we will get there, and 1,000 placements is no mean feat.
Oh, thanks ever so much, Sarah and Joe. That was an absolutely fascinating presentation. I think really interesting the approach that's taken in Greater Manchester with that whole systems approach, and using different elements of different funding, different schemes, and bringing that together so that there is that collaboration and collectiveness around homelessness in Greater Manchester, and seeing everything for some of its greater parts, really, instead of working in silos and isolation. I think that's a real area of good practice. I certainly found that absolutely fascinating. Hopefully we've got a lot of questions. I know that Jeff, you've popped a question into the chat box function. I'd like to invite you to ask your own question, Jeff, if that's okay, because it's quite an in-depth question. I didn't want to get the context wrong. So over to you, Jeff.
No, that's fine. I think I put earlier, I work as a volunteer with FASD Network UK from a point of view of lived experience as a carer for an adoptive lad who's been caught up in the criminal justice system. And within our community, we're constantly talking to each other, sharing our experience and our knowledge, which is quite extensive. I was speaking with someone within our community just the other week, where a lad, he's now in his mid-20s, been in and out of prison quite frequently, came out of prison with no accommodation provided. And it was, there was a cold snap at the beginning of, was it beginning of January? I forget. And the only provision that was provided by the local authority was under the cold weather provision, and it lasted for 4 days. And then now he's gone off the radar, because that's the complex nature of FASD. And as I put in the post, so often I go to meetings like this, others hosted by various sectors of the criminal justice system, health and what have you, and FASD doesn't even get mentioned. I mean, I just read the other day the action plan, which is coming out of HMPPS's report. The first report made a cursory mention of FASD, but it's now not in the action plan. So it doesn't even get mentioned, and it's more prevalent than autism. So my question, very specific question to the Greater Manchester people is, there is a very good support group for FASD in Greater Manchester, and some of the really good research is happening at Salford University around the criminal justice system, and it's being monitored by the head of the National FASD Clinic in Surrey. Are they feeding into your work? Because your work will be much better for that kind of collaboration. So I'll leave it there, but you can ask me anything you want.
I don't know of the FASD organisation that you mentioned, or the work that's being done by Salford University. I don't know whether Joe does.
No, I wasn't aware of it, and would appreciate the contact, Jeff, because that sounds really positive. I guess. So
I'll happily give you all the information you want.
Great.
I'll come back to you on that. Okay.
Great. And I do want to just pick up on one bit, Jeff, as well, that is in terms of the person that you mentioned. I think that was part of the reason that we're talking about it being a journey. So there are a number of areas that have CAS3, and so it is for prison release, people being released from prison, and it should or could be that the CAS 3 was available to that person. There are a number of details in terms of Homelessness Reduction Act that are relevant there. But also, I think one of the things that we are focusing on a lot is that we lose people. So people of multiple disadvantage, people with different experiences, there can be times when they're released from prison, directed to go to accommodation in some scenarios, not directed to go to accommodation, as you said, and we lose them. And that's not a good place to be. So we are working on that, about kind of how we're using mobile phones, how we're making sure that assessments are carried out in advance of release so that people have identified addresses to go to. We do recognise that that happens, and we're working towards trying to resolve that. But in terms of the FASD, I would welcome some more information. Thank you.
Thanks. And I think just picking up on the point that you've just made there, Sarah, around like the rollout of CAS 3. So obviously CAS 3 hasn't been rolled out in all probation areas yet. So there was the 5 vanguard areas or pilot areas, which Greater Manchester was part of. And we know that we're just awaiting for like the contract award notices to be sent out for the 6 remaining areas across the probation regions in England. It has begun to be rolled out in Wales, and that started last summer. Daniel, you have your hand up, so please ask your question.
Thank you, and yeah, thank you for the presentation. That was really interesting to hear about. Working so collaboratively with people in the voluntary sector and people with lived experience sounds kind of like a really great approach. So it's yeah, interesting to hear about it. I just had a couple of questions about just about your experience of CAS 3 and how it's working. I think the first question probably that most of us have with CAS 3 is that it's such an important lifeline, but there's always the question of what happens after the kind of provision. You know, people aren't eligible for the provision anymore. And are you finding it like people are able to move into Cecil's accommodation, or that there are move-on options, or do you find that that's very difficult still? And I guess the other kind of related question I had is about, from what we see at Switchback, there are a lot of challenges with the pre-release support and identifying people who would be eligible for these sorts of services. So I was interested, if somebody presented to a local authority a few days or a couple of weeks after they'd been released, like rather than being, say, referred by probation, would they still, like, is there a pathway for them to come into CAS 3 at that point? Yeah, so I guess just really interested to hear from all of the work you're doing, how those things are going.
Thanks, Daniel. Oh, sorry. I'll start with the last question, if I may. So the kind of pre-release planning and arrangements are challenging. We're trying to do a lot of that in advance of release. There are, we have some capacity within the specification that allows for people to go into CAS 3 for a period of 5 days whilst they have a homelessness assessment that then identifies their next steps. So if they're identified as eligible for interim accommodation, they'll go through the local authority temporary accommodation pathway. So it's like a 5-day breathing space, I guess. There are some problems in terms of customer journey there, though, because the standards of CAS 3, you get your own kind of dispersed accommodation, and then you have to move on to bed and breakfast accommodation through the local authority. And I think we're recognising some of that a bit more and trying to work out how we improve that for the individual. Once a person is released, they become ineligible for CAS 3 though. So if they are in the community, it is specific to people being released from prison. So if they lost their accommodation in the community for whatever reason, they wouldn't be eligible. However, there is a new clause that allows us to, on a case-by-case example, consider people who might have gone into approved premises for alternatives to recall to then come back out to CAS 3. So that's another option, but it isn't it is specific to prison releases, and it isn't necessarily the solution. What it does is it provides a breathing space. So the question around move on and what next is that we have 84 nights accommodation in CAS 3. From week 1, we are support providers, probation, local authorities working together to try and achieve the next step. And when I say from week 1, it's genuine that if we had less than 84 nights, we wouldn't achieve the next step very easily. We need that length of time to kind of really work on trying to resolve the next step. We have some challenges with that. Sometimes that can be about the individual engaging with services in a meaningful way that has some limitations that we need to kind of look at and adapt as we go along. Sometimes that is to do with the market currently. So whilst our aim is to achieve settled accommodation afterwards, private rented sector market is a huge challenge. We've got the Accommodation for Ex-Offenders funding, which provides rent and deposit scheme, but that's at LHA rates, and rents, as we know, are much higher than LHA rates. So there are problems around that. And one of the things that we are, again, a kind of real learning point is that I think there was an assumption at the beginning that people, because they were not identified as eligible for interim accommodation through the local authority or not priority need, they might be less complex, the people that are coming through the service, and that isn't the case. So we have a lot of people that have been priority need and then become intentionally homeless coming through our system. So there's really kind of multiple and complex needs in the cohort that mean that the kind of aspirational next step in terms of independent sustainable accommodation is unrealistic. So we're really seeing a need for supported accommodation as the next step. And we're learning a lot around when you get a referral and someone's spent time in prison, the expectations around how they're going to manage in independent accommodation, alongside some support, but independent accommodation can very much vary. So you can make some assumptions that this person's likely to be fine, and this person is probably going to find this really challenging. And actually, the reality within a couple of weeks is that it's the opposite to what you'd expected. So some people really struggle, and we're trying to then revisit whether they are priority need and sending information back to the local authorities, but also trying to work on next steps that aren't kind of sustainable independent accommodation because the needs are so high. Then there are a percentage of people that can be recalled as well. We need to kind of recognise the reality of the situation. So I think it would be very easy to present it as we have this temporary accommodation that's available on release, and the next step is, there's loads of people going into private rented sector accommodation and doing really well. There are a proportion of people that are doing really well, and they've found it an opportunity to really turn their lives around. But then there are a number of people who definitely require supported, high-level supported accommodation. And I think that's what we're seeing now, is that there isn't the supported accommodation available that we need. So we're using that as an opportunity to have the detailed data that evidences that, and communicating that where possible, I guess. Does that answer?
Yeah, absolutely. Yeah, that was the kind of thing I was interested in. So thank you.
You're welcome.
Thanks for that answer, Sarah. Fanula, I think it's over to you. Apologies if I pronounced your name incorrectly.
Thank you, Bryn. You pronounce it perfectly. Thank you. Although it's no problem if you don't pronounce it well. Fine. Thank you, Sarah and Joe. That's really interesting. I work for Transform Justice. We're a research and campaigning charity. One of the things we're interested in is about the localization of justice services. So I just wondered, you'd mentioned justice devolution, and I know Greater Manchester is a bit of a trailblazer there. I just wondered if you could say a bit more about how the fact that justice services are a bit more devolved in Greater Manchester, how that has helped improve outcomes here, you know, around resettlement?
I guess everything sits under the memorandum of agreement that we have in terms of justice devolution. So we place everything in that context, and that provides us a number of different spaces within which we can collaborate. So we have a Justice Rehabilitation Executive that sits over kind of everything that we do, that then feeds down into a variety of different forums through that governance framework that I had identified. The method for us that I see that's different to other areas is that GMCA have the opportunity to bring the 10 local authorities together in a different way, almost providing that 11th space that we can then connect to, which gives us opportunities outside of accommodation, broad range of opportunities outside of accommodation to co-commission. So we also have the Greater Manchester integrated rehabilitation services as well. So the CRS provision that's happening nationally, we've been able to use local data to develop services similar to CRS, but that are much more kind of locally understood and commissioned in a slightly different way. Would be some of the examples, but I could have a conversation for about 3 hours if you'd like, in a bit more detail around that. Joe, I don't know whether you have.
Yeah, I guess in terms of the case making and what works well, I suppose it's about, particularly for sort of nationally commissioned contracts, and especially for accommodation-based contracts, and this cuts across a number of different government departments. In some policy areas, I think local authorities are used to things being done to them rather than done with them. And when that happens, that's when you instantly kind of instinctively pull up the drawbridge a little bit, and that can sort of sour relationships a little bit. So I think there's a benefit of sitting alongside and co-commissioning that really helps to overcome that problem. Secondly, I think there's a recognition that actually through their statutory homelessness work, through other work, etc., local authorities are often really, really good at knowing what's in their area, what to connect into, what pathways work well, what the current accommodation climate is like, what the housing market is like, and who their local experts are that can really help drive that along, whether that's voluntary sector or otherwise. So I think you would be naive not to tap into that expertise. And likewise, local authorities would be naive not to take the opportunity to work alongside probation or other government departments to influence change. So I think it's about having that, breaking down those lanes between commissioning functions and governmental departments is really beneficial. And I guess that doesn't just sit at a strategic level. I think what's been really interesting about CAS 3 is that's down to the sort of operational delivery. So it's literally being in the same meeting, solving the same problems together and working on them as a shared problem, rather than two departments, if you like, independently identifying the problem and then clashing about it. So I think that's the key, and I think that's what we're learning. But it's, you know, as we continue to stress, it's a journey.
Yeah, thanks for that. I think that's a really interesting question there, because obviously you've got the devolution memorandum of understanding in Greater Manchester that allows you to bring all of those commissioners and partners together. So you've got the platform or the structure in place for this to work, and we don't always have that within other areas. It works differently in different areas. So I think what's interesting from our perspective at Clinks is what can the voluntary sector do to influence in other areas? And you may not have the answers to that, Sarah and Joe, but I'd be interested in your opinions on what voluntary sector organisations can do to kind of like advocate for this approach, the approach that Greater Manchester has taken within their own areas, whether that's talking to their area planning boards, or whether that's talking to reducing reoffending boards, or individual commissioners to try and bring people together. But I'd just be interested you know, on your opinions on that, if that's okay. If you don't have any, then that's fine, because I know that it's a big, complicated question, that. So, you know, that it's maybe more of a comment than a question. But
I think for me, my first thought was reducing reoffending boards, as you said, having a place at the table. And I think that as these are developed across Greater Manchester, we're broadening the people that are around the table there. So I think that would be one of the routes to do that. I would say that kind of a lot of what Joe was saying before, a lot of the processes involve voluntary sector organisations in a different way than what I've seen. So I don't know, actually, Joe, whether you...
Yeah, I guess there's...
Right.
You know, we are really lucky in that sense that we've got that devolved function. I suppose that even where that's not the case, there's nothing to stop voluntary sector organisations continuing to be a useful local voice and knocking on the door consistently and being a part of that infrastructure that might work more easily in some areas than others, obviously. But I think it's about helping to contribute towards the evidence base is always going to be welcome. So so generating quantitative and qualitative data that is useful to your colleagues in probation and other services is always going to be a helpful conversation starter. And then continuing to sort of get involved in the, as Sarah said, the existing infrastructure that does exist and being an active participant and bringing some of that insight back. I think that's never a bad thing, but it is a really tricky question.
Yeah, no, I really appreciate both of you trying to answer that. You know, from your perspective.
Just quickly, just as well to add on to that is some of the opportunities that the ROIF brings as well, that I think is something to tap into. That we have some really good voluntary sector organisations providing services for us through the ROIF that are really kind of local services that are providing some real positives. So we develop kind of reports that oversee some of the outcomes there that then mean that they have a voice at the table through that route as well, which I think has been really helpful.
No, I think, yeah, that's yeah, thanks for adding that, Sarah. So I think, yeah, the ROIF is, you know, is a good way of bringing that together as well. Has anyone else got any more questions for Sarah or Joe? Otherwise, we'll look to bring this session towards an end. Adam.
Hello there. I'm just wondering what input you have from lived experience with regard to implementing change. And part of the work I do, I run the New Leaf network, which falls under the umbrella of the New Leaf Initiative, CIC in Birmingham. And we're the only criminal justice network which is actually managed and led with lived experience. And we often find the actual professional input from people with lived experience is often overlooked. And I've attended today because personally this resonates an awful lot to me. I was told by my local authority I wasn't eligible to be housed. I went to crisis, they weren't interested. I went to shelter, they weren't interested. Challenged it myself, read their own rules back to them. Guess what? I got me flat and I'll be buying the thing next year when I got the right to buy. You know, right. But unfortunately, the third sector organisations and a lot of charities seem to be scared to rock the boat. Now, how can you have somebody coming out of prison back into the local community? Why would anybody want to contribute to that community by paying council tax, paying into the infrastructure, if that community doesn't want to house them? So rather than actually trying to shunt people into private rental accommodation, which is an expensive solution, and realistically, if somebody's on a low wage or anything like that, you're only going to go into a private rental if you don't intend to work and you're going to let the government pay somebody else's mortgage. You know, so there actually needs to be encouragement to actually get people into affordable housing in decent areas where they can actually carve a good life out for themselves. You know, and I'm just wondering what sort of true success stories you actually have from a lived experience perspective, you know, to bring to the table.
I think all of the points that you make are extremely valid, and I think it is one of the things that is a challenge that's probably a bit bigger than me to resolve. It would be my ideal to see genuine resettlement and responsibility around rehabilitation being a community responsibility as well as located in the individual. I think that this is some of the reality of what we face, and that we are using opportunities to advocate for people leaving prison and communicate this information as much as we can. I do think it's important to look at this as a step towards a recognition of that actually providing that breathing space is, and it's recognizing that there is like a demand failure and there is a need for this service, and there's a lot of money being spent on that. But we're trying to, as I said, use that learning to kind of upstream some of that. I don't think I'd necessarily have the solutions that are outside of kind of next steps being private rented sector. I hear what you're saying there as well, that there are challenges around people being able to work in accommodation, affordability, things like that, that are kind of much bigger than me. They are things that I see time and time again as well, and they're huge challenges, and good for you for kind of finding yourself in that position now, because that's really positive. We have, Joe has mentioned the kind of lived experience involvement, and it is really genuine and highly regarded involvement in the Homelessness Prevention Board and the structures through GMCA. I would recognise that we need to improve that within CAS 3 broadly. We have a lived experience organisation providing the support through Manchester City Council in Manchester, which is absolutely brilliant on the out. They've been brilliant, and they provide us with such a welcome kind of realistic perspective in support provider meetings and things like that. But it's something we could be better at. People who've lived experience of CAS 3 specifically are in the table, around the table for the one team approach as well. But yeah, I mean, I could definitely talk more about kind of aspirational thoughts about what it could be like leaving prison and how much better we could be at that.
But reassuring though to see we're all singing from the same hymn sheet at the end of the day. So yeah, you know, things are going in the right direction.
Yeah, cheers.
Great, thanks. Jeff, I'm just going to bring you in. You've got your hand up.
Yeah, I just want to echo everything that Adam said about, I mean, it's lovely to hear Sarah and others speaking about valuing lived experience, but in the real world, that is not done enough. I mean, there was a conference hosted by HMPPS and NICE called What Good Looks Like, which about 18 months ago, and they talked about, yes, we want good lived experience involved, and there was a lovely young fellow with autism who was speaking. But as I followed through, I've managed to make contact with the lived experience head within HM Prison Service. Initial response was good, and now it's gone silent. And I think, generally speaking, I've probably got cumulative concussion from knocking my head against brick walls. So you're right, Sarah, this has really got to be rolled out right across the whole of the criminal justice system and beyond. Lived experience is valuable.
It is, I mean, as you say, it is one of HMPPS's priorities to champion lived experience. But again, like we said, we're starting on a journey, and it's quite a new thing for HMPPS to do this and to recognise that. So I think it is to be kind of, that progress is to be celebrated, but there's a long way to go.
I agree, you know, echo that, you know, so I think, you know, there's, in the past, maybe there has been more of a tokenistic approach to lived experience, and it's absolutely, you know, we need to be valuing and really genuinely valuing the voices that lived experience brings, and that expert by experience, you know, so that we can look at systems change by using the expert voice that people with lived experience have. But that's really, you know, I think it is a journey, isn't it? And it's interesting to see, you know, the journey that HMPPS has been on with that. So, you know, I think there's good progress is being made.
Just to pick up as well on Adam's point there about kind of it can feel tokenistic at the beginning, and it can feel kind of superficial in a sense, but I think working towards making sure that people are paid for their time, valued for their contributions, kind of that, you know, they are really important things. We're not there yet, and I'd recognise that, but just in a small way, the people of lived experience that are supporting the one team approach are paid for their time, and really valued for their contributions. But there's a lot more that can be done, Joe.
Yeah, so I think this is a really good example of where working alongside and within other bits of the public sector that maybe are on a different point on that journey can be helpful. So within homelessness in Greater Manchester and the development of the Action Network, I feel like we're in a really good place with genuine lived experience co-production. We've got a ring-fenced fund to pay people for their time, for getting involved in the network if they're unwaged. We've got specific ring-fenced lived experience employment initiatives with partner organisations and within the Combined Authority through our Changing Futures programmes, and all manner of other different interesting and creative stuff that we do with people with lived experience. Now, that people's lived experience doesn't sit neatly within one different lens of the world. People who've experienced homelessness have also often had experience in the criminal justice system as well. So I think the ability for, and hence why we sort of said the greater involvement in the network is very much a next step. There's an opportunity there to tap into infrastructure that's already existing locally that can help to elevate some of those voices and result in meaningful change.
Great. Thanks, Joe and Sarah. I'm going to start to begin to wrap us up. Just want to say again a massive thank you to Sarah and Joe for their time this morning, for a really informative presentation, and then, you know, being able to take our questions and you know, be, you know, really give us a really in-depth, detailed, rich conversation that we've had this morning. And thanks to all of our contributors and everyone attending, you know, for also you know, adding to that and making that a rich conversation. Just before we do go, a couple of things. So as I said at the beginning, we will make sure that you know, we work with Sarah Burke from Wales to get a case study or something out of there, so that we can see what's going on in Wales. I was going to briefly go over that myself, but you know, the conversation has moved on now, so we'll wait for that. I just also wanted to talk about our state of the sector research, just to say that we've now launched our State of the Sector 2022 report. It explores the landscape of the criminal justice voluntary sector as it emerged from the pandemic into an increasingly challenging operational environment. Our annual State of the Sector research is produced in partnership with NCVO as a free resource evidencing what our members and sector are experiencing and the impact on their service users. And some of the key findings of that include the number of people criminal justice voluntary organisations support is increasing, and the level, complexity and urgency of their needs continues to grow. Organisations are working flexibly and in partnership to respond to changes, but larger caseloads are becoming a concerning feature. Organisations are more positive about their experiences, grant funding than contracts. Flexible, unrestricted multi-year grant funding is essential for stability, and some of the key factors identified by survey respondents for sustainability included developing new services, working in partnership, flexible multi-year grant funding, and a stronger connected centre. And I think Olivia is going to pop the link to the report into the chat box so everyone can have a look at that at their leisure. Once again, thank you ever so much for your time this morning. Thanks again to Sarah and Joe for their time and their presentations. Thanks everyone for participating in what has been a really interesting, and I hope you've all found it interesting and useful session. And yeah, I'll give you 6 minutes of your day back as well. So that's not too bad to boot, is it?
Thanks, everyone.
Thanks, everyone.
Thank you.
Thank you.